Hey, what up, girl? How you doing?
Can you guys see my screen okay? Yeah, okay. So we are doing it on sensory motor and processing frames. So a little background information. This frame provides a foundational approach to occupational therapy interventions, particularly for individuals experiencing sensory processing difficulties and motor coordination challenges. This framework is grounded the theories of neuroscience, motor learning, sensory integration, and sensory processing models. It also enhances occupational performance engagement and overall quality of life for clients with various conditions. Some history and theoretical foundation. It originates from the work of Jean Ayres in the 1960s, particularly her sensory integration theory. It demonstrates the role of central nervous system in processing sensory input to facilitate adaptive responses. And theories such as motor control, motor learning, and sensory processing models contributed to the expansion of this framework. So the core concepts of the sensory motor and processing frame, neuroscientific foundations, emphasizes the brain's ability to process sensory stimuli and organize motor responses. The sensory integration theory, again by Jean Ayres, describes how sensory input influences motor planning, coordination, and behavior. Motor learning theory focuses on the process of acquiring and refining movement patterns through practice and feedback. Neuroplasticity highlights the brain's capacity to adapt and reorganize in response to sensory and motor experiences. And then sensory processing model from Winnie Dunn expands on how individuals respond to sensory stimuli based on neurological thresholds and self-regulation strategies.
I guess so. The research and analysis on Jean Ayres' sensory integration theory is tactile, vestibular, and proprioceptive systems. The role of the sensory modalities in developing body awareness, coordination, and motor planning. Adaptive responses, the brain's ability to generate appropriate motor and behavioral responses to sensory stimuli. Plasticity of the neuron system, the ability to of sensory-based interventions to shape neural pathways and improve function. Also engagement in sensory-rich activities, the importance of structured sensory-based play to facilitate integration and improve occupational performance. Next, we have Patricia Wilberger's sensory defensiveness. The definition of this is sensory defensiveness is an overactive response to sensory stimuli, causing discomfort, anxiety, or avoidance behaviors. Types can be tactile, auditory, olfactory, gustatory, vestibular, and proprioceptive systems. Symptoms include individuals may be overwhelmed by textures, sounds, movements, or touch, leading to emotional distress or avoidance behaviors. As well as Wilber's theory expanded on Jean Ayres' sensory integration work, emphasizing defensive reactions to sensory input. We also included Wilber's brushing protocol. It uses deep pressure brushing and joint compressions to decrease sensory defensiveness. It is aimed at helping individuals' regulatory system input more effectively. Also used in populations in autism, sensory processing disorders, people with ADHD, and trauma-related sensory issues.
Next is Winnie Dunn's sensory processing model, which is categorized in 4 quadrants: sensory seeking, low neurological threshold with passive response, individuals easily detect and react to sensory input; sensory avoiding, low neurological threshold with active response, individuals try to minimize or control their sensory environments; sensory sensitivity, low neurological threshold with passive response, individuals easily detect and react to sensory input; and low registration, high neurological threshold with passive response, individuals may miss or not notice sensory input. The impact that this has on OT is assessment and intervention. OTs now screen for sensory defensiveness and create sensory-based treatment plans. Application in autism and SPD, Wilbarger's techniques help individuals with sensory challenges regulate their responses. Training and education, OTs receive specialized training in sensory integration in the Wilbarger protocol. Holistic approach encourages OTs to consider neurological responses to sensory input. The criticisms and considerations for this is limited scientific research validating the Wilbarger protocol. Proper training is essential to avoid overstimulation, and individualized approach is necessary for effectiveness.
So the scenario here, we're dealing with a child, a 7-year-old child with ASD, who's avoidant to tactile stimuli. Using the sensory integration model, the therapist would actually assess in a way where it's not where they'll actually look at the history of the milestones in the present time, like, oh, if they miss some milestones, and that's how they would kind of come up with this intervention. So in this scenario, the child is having trouble putting on clothes because of the clothing tags bothering them, and brushing the hair and the teeth, which is hygiene grooming, of course. And then what the therapist would probably want to do is expose the patient or the client to certain textures, using Play-Doh or fabric swatches. And this is going to help desensitize the child's nervous system. Also, you want to incorporate sensory-rich activities to help the child process sensory input more effectively. Sensory integration improves outcomes for children with ASD, particularly in self-care and social functioning. As you can see, this picture incorporates, some fine motor within the textures of the Play-Doh, kind of like a double-edged sword there. And of course, the swinging, which helps with the vestibular system input, and of course, it's also has a calming effect for the client as well. And then we're going to go to the next slide. So sensory processing model, Winnie Dunn's model, they assess the scenario with like a questionnaire. For example, instead of looking back on the milestones as Dr. Jeans would. So in this scenario, we have the same child, but then they're also having auditory sensitivities. So the therapist would, of course, maybe incorporate some noise canceling headphones, and then creating a quiet space for the child to I'm sorry, my baby is crying right now, but I'm trying to do this. And then noise canceling headphones so that you could increase participation in schoolwork. And then the therapist could also educate the patient on some relaxation techniques, some energy conservation techniques to also increase their participation. So the SPM offers a valuable framework for understanding how individuals respond to sensory stimuli, and research demonstrates its significant influence on the participation of children in daily activities. Thank you.